The nurse educator role is very complex. We have to ensure that we are equipping our nursing students with the content they need to be successful as they transition into practice. Welcome back to Dr. Sellars Educate. We're happy that you're back to continue to explore the four roles and responsibilities that we have as a nurse educator. The healthcare environment is plagued with challenges. We have a lot of turnover that's happening. We have a lot of staff vacancies as well as leadership vacancies. What strategies can we use to ensure that we're doing our part to best prepare our students for success? And at the same time, equipping our community with nurses that are going to make practice decisions that are in the best interest of the patient to promote the best patient outcomes. As we continue to explore Patricia Benner's novice to expert model and our responsibility to bridge theory practice gap, we have talked about four different roles. In this specific snapshot, we'll be talking about the third role. Okay, so let's just recap a little bit before we jump into role number three. First, we talked about designing educational programs, aligning our curriculum, getting feedback from our stakeholders, which can include our nursing students in the program, our graduates, our alumni, as well as our healthcare partners and our peer nurse educator colleagues as well. Role number two was the mentorship responsibility, engaging with our novice nurse educators or even our experienced nurse educators to make sure we're helping them be successful in the classroom and in the clinical setting. And then role number three, our ability to integrate evidence-based practices and to support the delivery of safe patient care. We want to align our teaching strategies with the evidence through appropriate presentations, engaging in active learning, and maybe even workshops to make sure that our students are closing their knowledge gaps. C&E review on the go for those colleagues that are on the journey to achieve C&E. We're excited that we're able to provide this resource for you now. We heard you loud and clear that sometimes you're just too busy to sit down and complete a review. You are able to scan this QR code, so I'll put it on large screen. You can go ahead and take a picture of it and scan it. This will automatically take you to the actual app. It's compatible with all devices. This will give you the content you need to close your knowledge gaps right at your fingertips. Now, if you're like me, when I was on the journey, I was a very busy mom. If I would have had an app like this, I don't think it would have taken me 8 years. Yes, that's right. It took me 8 long years to finally get to the point where I could celebrate my success on the C&E because life happened between PhD, a spouse that was deployed. My husband is a retired Marine. I just didn't have a whole lot of time. And by the way, I was a full-time mom, working full-time, and also achieving my PhD. And I know so many of you can relate. And that is why we launched this app. We had a great engineering team, and we've received lots of great feedback already. So make sure that you don't allow the barrier of not being able to sit down and study be the situation for you, because you now have a C&E review on the go app that's available. We think about reflection. We know Tanner's clinical judgment model talks a lot about the goal of reflection, being able to engage students in the practices that they chose and considering what their next steps are going to be when they have a similar clinical practice decision that they experience. Okay, that's a big part of reflection. Thinking about what happened, but more importantly, what's going to happen the next time students are faced with a similar experience. Chapter 18 in Billings and Halstead, that is an entire chapter that is dedicated to the role of teaching in the clinical setting. Now let's talk a little bit about what the content is that's included in our textbook. So let's start on page 330. Okay, starting on page 330, you're going to see information about the role of deliberate practice. This is us being able as faculty to create the learning experiences that are repetitive. So again, students being able to repeat some of these clinical practices in order for them to achieve a level of mastery. That's that skill proficiency that we want students to be able to achieve, where they are confident and competent in the steps in the clinical practices that they should take to ensure that they are delivering the safest patient care. And then what you're going to see also is simulation-based experiences and the value that they bring into the learning cycle for the student as it relates to clinical judgment, virtual clinical learning, and web-based simulation also. That's a great resource that many textbook vendors are offering now. These are all great virtual and some are hands-on experiences that students are going to have. We want to, as much as we can, introduce these to students in a way that allows them to use this reflective practice that we are talking about. So let's take a look at our thought-provoking question. Make sure that you also have your study worksheet that's out, because we want you to write down today's date, what objective you have to ensure that you are closing your knowledge gap. Okay, so every time you show up here, we want you to have Dr. Caputi's review book or Teresa Schallenberger if you're on the journey for C and ECL, and Billings and Halstead Teaching and Nursing. Right now we're in the 6th edition. The 7th edition is already out, but for content review and for C and E, NLN is still using the 6th edition, okay, at the time of this snapshot. Let's take a look at this thought-provoking question. We have positive clinical experiences can have a favorable influence on nursing students. A clinical faculty member observes a staff nurse being rude towards students and talking negatively about them. What should the best next step be to promote collaboration? We have A, address the behavior with the staff nurse. B, contact the unit manager to discuss the concern. C, notify the nursing program director. Or D, ignore the comment and focus on the students. So take a few seconds to think about two things. Okay, so for every question, we want you to think about, number one, what is the question asking me? And second of all, what is it that I know for sure about this thought-provoking question? All right, and now let's talk a little bit about what it means to truly integrate our evidence-based practices into clinical practice. What are some steps that we can take as an educator in the classroom, in the skills lab, before students even arrive in the clinical area, to ensure students are properly prepared to provide safe patient care? First and foremost is we want to make sure there is alignment between our didactic faculty and our clinical faculty. Now, when I say clinical faculty, I'm using that as a loose term. That is referring to our skills lab and SIM faculty, as well as our actual clinical faculty in the healthcare setting. We want to ensure there's alignment. So that means that we have to sit down and we have to do planning. When we think about what assignments students are going to complete, which specific body system are we going to focus on in that specific week? Do students have a chance to actually apply those skills that we are teaching them in the didactic setting and that we are testing or evaluating them on in the skills lab? And then we started with role number one, curriculum development, for a reason, right? Because we're building on it. First, we talked about curriculum, then we talked about mentoring, and now we're talking about integrating these evidence-based practices and aligning our learning objectives, our student learning outcomes, with the actual clinical experiences that we are planning for our students collaboratively with our healthcare partner. And then the second component is providing that guidance, right, with our nursing students, giving them formative feedback in hopes that they will make corrections to their clinical decision making and the practice decisions that they are making to provide quality patient care. So that formative feedback is really critical when we think about how we shape students' learning and ultimately how they're able to transition into practice post-graduation. We want them to be competent and confident so that they are ready to practice and providing safe patient care, and ultimately the patients are having really good outcomes. All right, so if you chose B, contact the unit manager to discuss the concern, you are correct. Now let's talk about why. The other options don't support collaboration and building relationships between nursing leaders and clinical faculty. This episode has been helpful. We do want to remind you all from a testimony that we received from Dr. Alexander. She says that she was pleased to announce that she took her test that morning, that was on November 18th, and that she passed. To God be the glory. I'm so glad He put you in my life to help me through this journey. Your program clearly helped to guide me, kept me focused, motivated and nurtured me to this point. If I can do it, you too can be successful. That is our service guarantee here at Dr. Sellars Educate. We will support you until you are successful. Reach out if you have questions. Until next time, have a great one, everybody. Bye bye.